And the next antiviral drug we should be discussing this evening is known as the Adefovir dipivoxil. Okay, Adefovir dipivoxil. So we're actually going to discuss all the antiviral drugs that exist in the world, both the ones that are always being used, like commonly being used, and also the ones that are rarely being used. You understand? So Adefovir actually have the pictures here. You don't have to worry. I'll upload the videos, okay, on the Pharmacology channel. So Adefovir dipivoxil, just so you know, is an oral antiviral drug. Okay, sorry, viral drug. Is mostly used in the treatment of what? Hepatitis B virus infections. Okay, so some of these drugs you don't really see them commonly around because they are being developed to tackle just a single type of infection. Okay, so what's the class of this drug? Is a nucleotide analog reverse transcriptase inhibitor. That's the ones that they call the NtRTI. Okay, so mechanism of drug, Adefovir dipivoxil is not an active drug, it's a prodrug. When you give it to a human being, it will be converted to Adefovir only. So how does the Adefovir work? So after oral administration, the Adefovir dipivoxil will be converted to Adefovir, which is what? Phosphorylated intracellularly, that's inside the cell. It will be converted to active metabolite, which is known as what? Adefovir diphosphate. So the metabolite is what will now compete with natural nucleotides. It will go into the viral DNA. It will now what? Terminate how the viral replication is going on. So they call that the chain termination. So this will inhibit what? The hepatitis B virus DNA polymerase. Okay, this will now reduce how the virus is making other copies of itself. Okay, so moving forward, pharmacokinetics, oral bioavailability is about 59%. Distribution is widely distributed, but there's low plasma protein binding. Metabolism is not significantly metabolized. Excretion is primarily what? Through the renals. Okay, so half-life is about 7 hours. Okay, so therapeutic uses is used in treating what? Chronic hepatitis B virus infection. Okay, so it's sometimes using hepatitis B infections that were actually resistant to lamivudine. Okay, so most of the times people use lamivudine, they resist it, they have to opt in for this. It's not effective on HIV. Okay, so adverse effects can cause asthenia, can cause headaches, can cause abdominal pains and diarrhea, can be toxic to your kidneys. Okay, can cause lactic acidosis, can cause enlarged liver, that's hepatomegaly, steatosis. Those ones are rare, do you understand? So I think